Hi, my name is Javier Escaned, and it is a pleasure to share with you some of the results of a sub-study of the REDUCE-MVI trial that will be presented today at EuroPCR 2023. This is a study that focuses on the topic of revascularization or identification of functional relevance in non-culprit lesions in patients who present with ST elevation, myocardial infarction, and multivessel disease. An important topic that has been the focus of major trials, and that in particular the last one, the FLOWER-MI trial, demonstrated that intracoronary physiology to identify these lesions perhaps was of not help. The unique characteristics of the REDUCE-MVI trial, in which non-culprit lesions were measured with intracoronary physiology, FFR, at the time of primary PCI, and subsequently performed a new measurement 1 month later, gave us an opportunity to test a hypothesis. Perhaps in angiography-based physiology, in particular the quantitative flow ratio, QFR, which is not influenced by transient changes in the microcirculation, might be a better predictor of the results of the functional relevance 1 month after STEMI than FFR itself. And for this, what we did is, again, in this sub-study of the REDUCE-MVI trial, we analyzed this predictive value of FFR or QFR performed at the time of primary PCI in predicting the functional result 1 month later. The results were very interesting. We found that QFR is a better predictor of FFR at 1 month than FFR itself. And we think that this is probably due to the fact that, again, microcirculatory boundary conditions are shifting. We also found that coronary flow reserve actually had a significant increase of values, while FFR had a significant decrease in values in the month elapsed from primary PCI to the second measurement. QFR was not affected by this, it was not changing over this time. We believe that this information is important because perhaps QFR or angiography-based physiology will be the best approach to make decisions on revascularization in non-culprit lesions in patients that have ST elevation myocardial infarction compared with wire-based physiology. And we have also taken into consideration that actually angiography-based physiology is more versatile in making decisions. For example, you can perform these assessments in the angiograms of the patient that was in whom primary PCI was performed the night before, for example, and obtain this information without bringing the patient back to the cath lab again to perform a new set of measurements. If you're interested in these results, they are already accessible in the online publication of the article in JACC Cardiovascular Interventions that was made simultaneously with the presentation of the results as late-breaking clinical trial by my colleague Ling Wang. Thank you.